TrueCare has spent a lot of time making sure our patients can utilize MyChart as well as its features such as self-scheduling. The reason this is so important is because it has direct impact into our patients. It gives them the opportunity to take control and really be involved in their own health outcomes. As many of us can imagine, we've often been in circumstances where you or your loved one or your child may be sick in the middle of the night. You wake up, you have a sick child, you're not sure what to do. One of the first things that might go through your head is, what am I gonna do? Am I gonna take off work tomorrow? I have got to see my provider. So there's real beauty when you can pick up MyChart in your hand or on your app and message your provider, communicate with your care team, tell them what's going on, and create an appointment for that next morning. You can even go as far now as to complete the pre-check-in steps and complete a patient-errand questionnaire. So as a patient or a parent, you can then go back to bed with that peace of mind of, okay, I've taken the first next steps needed for the care of myself or my child. That's the reason why we implemented the Patient Engagement and Digital Literacy Program, because patients really do need assistance in this area, particularly for an FQHC. Patients aren't going to be as comfortable with some of this technology. In fact, some of them might be intimidated. So you really need to spend time, meet your patients where they are, and offer a variety of initiatives to help them learn to understand, utilize, and embrace all of this technology.
The project that we chose to work on is a system of care that we call Indigino, or Indigenous Knowledge Informed System of Care. This centers traditional Indian medicine on the care team and infuses Indigenous knowledge practices throughout our organization, both clinically and operationally. For this project, we worked with OCHIN to develop tools within Epic to document traditional Indian medicine interventions. We built out note templates together, smart sets and smart tools, flow sheets, questionnaires, MyChart integration for it, as well as IUC codes for billing and the billing process for documentation as well. The impact of our project so far has demonstrated a moderate decrease in anxiety and depression symptoms among participants, as well as a major decrease in both alcohol consumption and suicidal ideation. In addition, using the Indigenous Knowledge Informed System of Care operationally, we have been able to increase access by reducing unused slots and decrease our cycle time, while at the same time actually having more care team touches for the relatives that we serve. For this project into the future, we are focusing on spreading our Indigino model throughout the rest of the clinical and operational systems within our organization. We will be opening a new substance use treatment facility that is infusing Indigenous knowledge-informed care model within its framework. In addition, we are advocating at the state and federal level to allow for traditional Indian medicine to be reimbursed through Medicaid and Medicare, and working to build taxonomies and MPIs for traditional Indian medicine practitioners.
So the focus of our project was, how do we address burnout? And the reason that's a big deal is because we're all feeling the crush of change, and we're all tired. And we hear it every day. People are tired. People don't have enough time to see patients, but we're wanting to see more patients. Our patients are asking to see us more, and so we want to meet that need. So how do we do that? How do we give you more time when you feel like your time is taken up by so many other things? So our project really sought to focus on how do we bridge this gap with education to improve efficiency. And so that if we can make you efficient enough to give you time back at the end of the day, that's time for you to go on a bike ride. It's time for you to go spend with your family to reduce burnout so that we don't have this turnover that we've been experiencing, that everyone's been experiencing after the pandemic. And that we can kind of keep our own and grow our own. The way we did that was with a three-pronged approach, really to drive home, again, EPIC education to improve clinical efficiency. We're also seeing time given back, which is the main crux of this. It's like, how do we give people time back? And that ranges anywhere from 20 to 90 minutes back in any given day for people to go home, be with their families, get outside, and pursue whatever makes them well.
We are located in a rural area in eastern North Carolina, and what we recognized that we had a subset of patient that we deemed as lost to care due to social challenges or even comorbidities, where it was preventing them from accessing the care in an office-based setting. It was really important for us to make sure that we focus more on health equity and come up with a way to outreach to all of our patient population, especially those who were chronically ill. So part of the learning experience is really ensuring that we are incorporating technology in all that we do, especially as we're trying to close the gap in equity and even more or less equity, right? So some of the things we did incorporate was a mobile hotspot where we actually did measure the connection rate, which is a 93%. We also leveraged a mobile telehealth services. It was a mobile device called MedPod where we were able to take it to the patient home. We had our community health workers and also our telehealth nurse involved in this process as well. So what we understood is taking it beyond, right? And being innovative and really meeting our patients exactly where they were and really focus on being equitable across the board as well too. So what does the future look like for us? So we are definitely taking this and running with it. We are going to be expanding even on a wider range to the rest of our patient population. We are also looking at utilizing MyChart, but getting really creative because we did recognize that we have low utilization within our patient population. So we are going to place even more resources. We have thoughts about patient navigators. We have thoughts about, bringing in a kiosk, which would be more of a pilot, but really help our patients complete things as the SDOH screening, right? Where we can really better understand where our patient needs services and where they even need more of the help. Because we recognize that this initiative that we took on with the telehealth services really did improve and enhance our patients' health outcome as well too.